back. Joining us now is Dr. Judy Schechter, Associate Chair of Pediatrics at the University of Miami's Miller School of Medicine, founder of the Injury-Free Coalition for Kids, and she serves on Florida's Children and Youth Cabinet. Dr. Nelson Adams is the chairman of the Department of Obstetrics and Gynecology at Jackson North Medical Center. He is president of a managed care company that provides services in 26 counties in Florida, and he is a longtime advocate who is dedicated to eliminating racial and ethnic inequality in health. And Dr. Tresha Gambon, a pediatrician at the new Maternal Child Health Center for Citrus Health Network in Hialeah. She is a member of the Executive Council of Community Pediatrics at the American Academy of Pediatrics and a dedicated advocate on the board of the Children's Trust. We'd like to ask you some questions about Medicaid reform. What's good in this bill that's being proposed, and what scares you, if anything?
Well, I'm happy to start. There are two Medicaid reform bills, and they're actually very different bills. So the House has a bill that has a lot of what we need to happen in managed care, but it is a simpler bill. The Senate bill has a lot of perks in it and some extras that we need to take care of children correctly. It's important for us to remember that managed care in and of itself is a good thing, and that the classic studies on it have shown us that we can maintain quality outcomes while we reduce costs. However, there are two groups from that classic study that stood out as not having those same outcomes, and those were children and people with complex medical needs. In those cases, we need to be very careful that we do the right thing with managed care in Florida. And Medicaid reform right now, it's iffy to say whether children and the most vulnerable medically will be protected.
Trisha, Dr. Nelson, any thoughts on this?
Well, I think I have to agree with Dr. Schechter that the Senate bill does have some great parts to it that are included that will help protect care for the children, but the House bill has a better reform bill for Medicaid.
I'd simply like to add that, you know, when it's all said and done, what's best for these most vulnerable populations is what has to be done. The advocacy call must be to do the very best that we can, particularly for our children.
What about pregnant women? You're an OBGYN, in particular pregnant women. How might be they affected by the reform?
Eliane, I'm glad you asked that. You know, maternity care obviously is special to me because that's what I do for a living. Anything that will decrease the resources and the access to care to beneficiaries is a bad thing, particularly for women who are pregnant, because of the obvious extra burden, no pun intended, that they have. Number one, we must make sure that the care is available. Number two, it must be affordable. There are some iterations of these proposals that talk about copays and additional financial burdens. During pregnancy, oftentimes there are multiple visits, sometimes 10, 12 visits during the course of a pregnancy. Certainly if there were monies required at each of those visits.
Is there anything particular that you see right off the bat that is troubling for you?
Well, the most troubling is the fact that there are talks of cuts, and particularly for the maternity patient, if anything is cut, then you end up having a situation where you could put not only that mother but that child at risk. So cutting resources is the major concern. We know that in a very short while, in a few months, we've got to get word from CMS whether or not reform, if you will, is going to continue. If it does not, then we've got some real issues and some head scratching and real thinking to do.
Yeah, Ileana, if I can jump in there, I think what Dr. Adams is outlining is what I'd call a kamikaze provision in the Senate bill. And what it says is that if the federal government doesn't continue the Medicaid reform waiver that we've had at this point that's operated in a couple of pilot counties, that Florida would pull out of our federal match. That means losing more than 50% of the dollars that we put into Medicaid now. If we lose those dollars, then we don't have the money to take care of our people. It also means that the state, not the federal government, will be able to say who's eligible, who's not, what are we covering. It would change the topography of what we're dealing with substantially, and our people would really feel that.
And I think the other concern that I see with that is if we were able to get a waiver, which is completely, has to be decided by CMS, by the federal government, to get the waiver, part of the Senate bill also includes a cap, meaning that it becomes a grant that's only a set amount of money, and when that money starts to run out, then there's provisions on how to decrease services, decrease reimbursement to physicians, and decrease the availability. Decrease, which is very concerning, because especially for the developmentally disabled or people who need, or the pregnant, people who need continuing care, what would happen if 8 months into the year there's a decrease in the funds? And then how would the funds be appropriated, and who would be able to continue to get services to finish out that budget year?
KidCare legislation that's moving through the Florida Senate would tie that application to the application for free and reduced lunch. What is the potential impact on uninsured children in the state of Florida?
This is one of the most exciting parts of the Senate Medicaid Reform bill. It's also filed separately by Senator Sobel and has passed through its first committee unanimously, so there's strong support for this. The idea here is that we could simplify the process of KidCare enrollment so that the free and reduced lunch applications that all of our public school kids apply for anyway, that information could be used and translated to see if kids qualify for Medicaid and Healthy Kids. So it increases awareness about the program overall. It simplifies the process, which makes it easier for everybody, and it could substantially increase the number of enrolled children in the public schools from age 4 through 18, as well as the private schools, because we'll raise knowledge of the program.
Is there enough money to do this? Is it a good investment?
I absolutely agree that it would be a good investment, because care for children is not very costly for what it provides. We know in the Medicaid program, over 50% of the enrollees are in Medicaid, and they cost less than 30% of the dollars. And obviously, we would like to provide as many services to our children. And we know that if children have insurance, they do have more likely to have access to a primary care provider or medical home, and less likely to utilize the ER, which is a high-cost service.
And remember, when we talk about state dollars for Medicaid or KidCare, we're talking about a huge federal match. So the federal dollars that come in are 50 to 70+%. Under health care reform, it'll go up to 90 to 100% of what the cost is.
Absolutely.
Well, there's no question this is going to be an interesting session. There is a bill, in fact, in the House that has already passed its first committee in the state Senate that would make it illegal for health care workers like doctors or psychologists to ask if there is a gun in the home, to ask a patient if they have a gun in the home, for example. Dr. Schechter, I think you have a slight opinion on this, right?
Well, I have opinion because I'm a pediatrician, as is Tressa, and I take care of kids, and the main thing that we like to do is prevent illness and injury. In Miami-Dade, we lose children. We lose 2 children on average every year to unintentional gun death. We lose an average of 5 to 6 every year to suicide. Most of those gun deaths happen in the home. Most of them are with a gun that was found in the home. In fact, even when somebody was shot by another person, over 50% of the time it was somebody in their family when we're talking about kids. It's critically important that pediatricians, psychologists, psychiatrists, anybody involved in healthcare who wants to do prevention is able to talk to their patients about all sorts of things, whether it's protecting them from a drowning or a burn injury or a gun injury.
In other words, I come to you, you feel that I might be depressed, and you want to know whether I have a gun in the house, and I might be inclined to use it. And you would ask me, do you have a gun in the house? And in this case, it would be illegal for you to do so, and there would be a penalty of some sort.
For sure, and I would want to ask that of you, but I would also say if you had a teenager who in their normal development is supposed to have mood swings and breaks up with their girlfriend, or a toddler who you may not realize can now move the chair and climb up to get the shoebox over the toy chest where the gun is hidden, I'd want to talk to them too, even if they didn't have red flags.
And this would be a crime?
Mm-hmm. It would be a crime. The first version said it would be a felony. Those penalties are weakened somewhat. But this still is a gag order on physicians from doing what we do best, which is working with families to help keep their kids safe.
Did you ever think it would come to this?
I hope it doesn't. I hope that people speak up and let their legislators know that we don't need that sort of government interfering in the privacy of the exam room.
Yeah, speaking of taking action, we want all of you watching to know that now is the time to call, to write, to email your representatives in the Florida legislature to let them know how you feel about where your tax dollars should be invested in support of children and families. I'm Ileana Varela. On behalf of the Children's Trust and Modesto Abeti, we want to thank all our guests for being with us and all of you for watching from home this special edition of Our Children. Enjoy the rest of your day. Our Children is brought to you by the Children's Trust. The Children's Trust invests in programs and services that help make children healthy, safe, loved, ready to learn, succeed in school and in life. To access its funded programs and services in Miami-Dade County, visit thechildrenstrust.org or call the Children's Trust helpline at 211, because all children are our children.